Which of the following need priority action? You have 4 patients. Which one do you see? Let me give you a clue. I don't have to go through the prioritization method, but in OB, you don't have to be emotional. When you see OB question, don't be emotional. As an entry-level nurse, you want to avoid morbidity and mortality. So that is the most important. You take care of the mother. Morbidity and mortality. So think about that and don't be emotional about it. So we have 4 patients. A client, 8 weeks pregnant, present with sudden onset of left lower quadrant pain. A client, 20 weeks pregnant, with sudden onset of dark, painful vaginal bleeding. A client, 30 weeks pregnant, with sudden onset of painless vaginal bleeding. A client, 37 weeks pregnant, in labor with sudden onset of loss of fetal station and cessation of contraction. Who has a priority? All of them, I'm telling you, has a priority. They are pregnant, they have babies, you got to take care of them. But this, you have to be sharp. Put your thinking cap on and look at which of these problem all of them have. What is on the B sharp that they have? They all have problem that you can find on the B sharp. 8-week pregnant lady with sudden onset of left lower quadrant pain. This is what? Ectopic pregnancy. And what is ectopic pregnancy on the B sharp? This will lead to shock. A client 20 weeks pregnant with sudden onset of dark, painful vaginal bleeding. What is this? Placenta abruption. This is an abruption. What would it lead to? Shock and demise of the child. Okay. A client 30 weeks pregnant with sudden onset of painless bleeding. This is placenta what? Previa. This also can lead to shock and demise of the patient. A client 37 weeks pregnant in labor with sudden onset of loss of fetal station and cessation of contraction. This is uterine rupture and fetal demise. Who will you choose? If you have to choose one patient, that is your job as an entry-level nurse. They want you to think and find one patient that you don't have time with. Who do you have time with? Who do you don't have time with? Who can you wait and do certain maneuvers to fix the problem before getting them to the surgery to do something about it? Who does not have time? That's what you keep on thinking. This patient does not have time. I don't have time to think. Ectopic pregnancy, you resuscitate them, and get them to surgery. Sudden onset abruption, resuscitation, do certain maneuver, no vaginal exams, turn the mother on the left side, and get them ready to surgery. You need a client with aprevia, no vaginal exams, provide resuscitation, and then probably usually it will stop and there is no problem. In the D, number 4, 37-year-old pregnant lady, loss of fetal station, that is a clue. Loss of fetal station, the fetus have moved from one station to another. You can't find the station. And then there is no contraction. The uterus is ruptured. There is massive hemorrhage. The baby can be saved. The mother can be saved. But who do you choose first? The mother has to survive for the patient to survive. You need to do something. So this is emergency session right away. This patient is your priority. And that is how you answer a B-sharp question. You have to think, how much time do I have? If I put my thinking cap on, and I need to be sharp. I can't save all, but the one you can save is number 4. So this is how it's done. Take care of yourself and keep charging as always.